Hello and welcome to the Buena Vista Project, a podcast about Mexican-American history, politics, cultura y más, coming to you from San Antonio, the Mexican-American capital of the United States. I'm your co-host, Michael Quintanilla.
And I'm your co-host, Elaine Ayala. Our guest today is someone whose leadership touches lives across San Antonio every single day. We're honored to welcome Dr. Cherise Rohr-Allegrini, CEO of the San Antonio AIDS Foundation, known as SAAF because of its acronym, SAAF. Dr. Rohr-Allegrini, we're going to call you just Cherise in this show, is an expert in public health, nonprofit leadership, pandemic response, and she's a respected voice in the scientific community and in HIV/AIDS work.
Dr. Rohr-Allegrini, known as Dr. Cherise, well, to me at least, and I think so many people out in the community as well, is active in city planning, neighborhood organization, and housing policy. She's always working to especially strengthen the most vulnerable in San Antonio. Her academic journey is just as impressive, and you must allow me to say this, Dr. Cherise. She has a PhD from Notre Dame, 2 master's degrees from Yale University, and she has participated in the San Antonio Hispanic Chamber of Commerce's Latina Leadership Institute Class 3. We're thrilled to talk with you. I mean, come on, data, science, and humanity all at once, especially humanity. You have such a big heart for our community. Dr. Cherise, SAAF celebrates a monumental milestone this year, and that is the 40th anniversary of the San Antonio AIDS Foundation. That's major. And you have a celebration plan that honors 4 decades of service, advocacy, and community care. Before we get into the story of SAAF and how you continue to sustain the foundation, because there have been so many cutbacks, as we know, tell us about this fundraiser on August 29th. What can the community expect from this anniversry event?
Well, first, thank you for having me here. I'm so excited to be here.
I have to say, you're overachiever.
But so
I'm really not.
I
I'm
mean,
a really late bloomer.
and what I need to tell you is that she is part Mexican American,
Yep.
part German, and she's married to someone who has family in Switzerland. So you're all over the map, but go girl. Are you from the west side, south side, or where?
I'm actually from LA, Los Angeles, where I grew up.
Oh, okay.
But I've been here a long time. I've been here since 2001.
So you're already a San Antonio.
I've been here longer than I lived in California.
Okay.
So.
All right. Okay, answer Michael's question. Sorry.
But she's so perfect for this job.
Yeah.
Oh, thank you. So we're really excited. On August 29th, we're going to be having our brunch, and it is a 40th anniversary brunch to celebrate our 40 years of service in San Antonio. If you've been to any SAAF event, you know it's fabulous.
Yes.
We're all about the fabulous. We're all about the fabulous party, though, wonderful entertainment, wonderful atmosphere. We are going to have a presentation that's a bit of a performance that will be walking us through the 40 years of HIV and the 40 years of SAAF. With people from the community participating in that, so we're very excited about that. We are going to have an award that is a memorial award in honor of one of our longtime supporters who passed away last year, Ron Malone. Absolutely wonderful person in the community, and so we are having our first award this year. I'm not going to say who that's for, who's going to get it, in honor of him, which we're very excited to offer. And it's going to be held at the TPR event space, which we're really excited about as well. It's such a beautiful space. So we're really looking forward to that on the morning of August 29th. The ticket will include a meal, open bar, and performances and talks about the work that we're doing. And most importantly, those funds will help us continue the work that we do. And I'm just going to be really boring here and say, help us replace our roof. because it is leaking so bad.
You need a
And those
new
are things
roof.
that grant funds don't do. And so all of this fundraising that we do, the little bits here and there, they help us to keep the building functional so that we
Yes.
can provide the services that we provide.
Yeah, the
And
infrastructure.
grants,
Yeah.
grants
Yeah.
don't pay for that.
Grants don't pay for that. And it's not sexy, but
Yeah.
Yeah,
it's
it's
what
what
has
it
to,
is.
if I've got a leaky roof, I can't see a patient.
Yeah, the
right.
well-being of the infrastructure of the building is so vital
Right.
to be able to help others
Right.
come into the building.
And if I can talk to you about the building, I know we're really going to go into that later,
go
but since I
ahead.
brought that up. So we're in the same space we've been in since 1991. And it's an old building, but it's a very special building because it holds so much history. And the location is great. It's centrally located, and that's important. And a lot of people say, why don't you just move? Well, we have to move pretty far outside of town, and that makes it difficult to provide services.
Yes.
That's right.
But the energy in that building, the memories in that building are so important to what we do every day that I feel everybody that walked through those doors and people who pass there, I feel their presence when we're there. And I think most of us that work at SAAF do. So that building itself is so important to us.
Yeah.
We want to talk about SAAF today, but it's impossible not to talk about SAAF back then because there's so many of us that have stories about how SAAF helped a member of our family, and for me it's my brother Albert, who died in 1999. And while he was able to get some of the services that were available at the time, it wasn't enough. So take us back to that beginning, to those early years when the obit section was filled with losses, and those uncertain years when compassion, it's always as important as the care, the physical care. So talk about those origins.
Of course. So 1986, I was a teenager in California. So I wasn't here, but these are the stories that folks have told me. Papa Bear Edwards, Robert Edwards was his name, owned a gay bar on Broadway Street. And it was a time when, particularly gay men, HIV affects all, but this was particularly gay men in the community who were dying. And they often were estranged from family. They had no support. And there was nothing that could really be done. We didn't have medical care that could really help at the time, except for providing comforting care. And so he said, I have to help these people. And he gathered a group of bar owners. They actually set up the San Antonio Tavern Guild to support people that were dying of AIDS. And he opened a home for them to stay in, and he had volunteer nurses who would come and take care of people. They'd raise funds to this tavern guild. Out of his bar became a community center where people would come to talk about what was going on, to just connect with people in the community, figure out what to do. When testing became available, he started testing from his bar, one of the first to do so, giving out condoms, and people in the community were not happy about that.
Yeah.
But he did it anyway, and I didn't get to meet Papa Bear, but for those of you that know him, know he was not somebody to take no for an answer. He said, too bad I'm doing it, from what I hear. And I can imagine him very well. And so he did those things that were necessary, and that was starting in 1986. 1991, they moved into the facility we're in now, which was a former nursing home. And it was mostly was a place to go to die, but it was a place to go to have comfort and compassion and care. And while we didn't have treatment for AIDS, or what we did have was very poor treatment, and most people did die that were at that stage, there was activities for people to do. There was community. We provided meals. They did art. They had a chapel. They had so many things to just create this community of support while people were living out their last days.
And I recall when my brother and I moved back to help care for him, that he was among the lucky. We all rallied around here. Our family did, our friends did, his partner. But for so many others, they had been ostracized by their families. Many were indigent. And I remember there was a sense like, thank goodness we're here for him, but we know that there are
Right.
people that were left alone.
Yeah, they're socially isolated.
Right, exactly. So having a community like that was so important, to have friends, to people that you can go to, and even for people that were not dying, for people that were living with HIV and still relatively healthy, SAAF became a place to connect. A place to find other people experiencing the same things you were experiencing, as well as to get information and resources as medical care started to become available. We did have some medications in the early 90s, the cocktail that for a
Yes.
lot of people, they said that made them sicker than the
Yes.
HIV, and it wasn't great, but it was all we had. By around 1995 is when we really got the newest medications that really seemed to make a difference. For a lot of people, it was too late. But that's where we really start to see the change around 1995. I want to say it was 1997 in San Francisco. The Bay Reporter they published obituaries every day, and from the early 80s until that time, I think it was 1997, there were obituaries, and they had a big advertisement the first day. There were no obituaries to post. I don't have something similar for San Antonio. I don't know
But
the
it was
dates,
a
but it was
dramatic
similar.
change.
Yeah,
Very
it went
dramatic change.
from hundreds to tens to down to zero finally. We do see deaths from AIDS. Mostly it's because people don't access care. They don't know they have HIV, or because of stigma, they're hesitant to get tested, or they're hesitant to go into treatment. Our treatment is amazing. Most people can live very healthy, very long lives with HIV. A lot of the talk we do now is about aging with HIV, how to make, how to address some of the other issues that you have. Because there weren't a lot of people that had HIV in their 70s and 80s. That's very new for us now. And so we're talking about some of the things that people are dealing with related to that. But fortunately, because of this incredible medication, we've been able to transition from an infection that almost always led to death to something that people can survive with and live as a chronic illness that you can manage. And we do have people that were diagnosed in the 80s that are doing well, that have never got an AIDS diagnosis. Yeah, it's
And
amazing.
they look really healthy.
They do, and they don't know why. We don't know why. Why did my friend die this horrible, miserable death, and why did I survive? And we don't know. And that's another thing that a lot of people have to deal with, that survivor's guilt. That's a challenge.
So, Dr. Cherise, at one point, so we're talking about the present now, but at one point, SAAF did have inpatient care?
Right.
Okay.
Right.
And now there's outpatient care?
So we were a residential care facility from, as a volunteer in 1986 out of the house, and then 1991 when they opened this facility. It was a residential care facility until about 2016. At that point, I wasn't at SAAF yet. I've been there 6 years. They had just a handful of patients. And part of the problem originally is nursing homes wouldn't take people, and
that's right.
people with HIV or gay people that couldn't go to nursing homes. That finally changed, and also because management of HIV was so improved that most people with it were fairly healthy and could live independently, that we couldn't have an inpatient facility for less than 5 people. You can't run it financially like that, and so they transitioned to an outpatient facility. And so 2017 we opened our clinic, and in addition to that outpatient facility, we have a pharmacy, we have all these other services, which I'm happy to go into now.
Yeah.
So we provide
a full pharmacy?
Yes. It's called the Care Clinic Pharmacy, and right now we're open 8 to 5 Monday through Friday. But we're looking at additional hours, but they are full pharmacy. It's right located inside of our clinic, which is great. So if you have your doctor's appointment, you can walk across the clinic and pick up your medications, or we mail them to you, or we work out easy ways to do that. But we did transition to this outpatient facility, which now we have about 700 patients living with HIV, and almost 200 PrEP patients, and then a number for STIs that we treat.
One of the
That's
things
wonderful.
that fascinate me is when the AIDS epidemic or pandemic, whatever you use, began. There was certainly a profile of the patient, and I'm sure that sort of changed a little bit. Tell us about the populations that are are being tested for HIV, and then they have HIV, and then they
Sure.
manage it. And for those that are now at having AIDS and managing that disease.
So in the early days, it was primarily diagnosed in white gay men. Those were the people that had access to medical care. Doesn't mean that's not in the other populations, but those were the folks that had access to medical care.
And it was first reported in Los
It was
Angeles.
first reported in Los Angeles, right, 1981. And in a gay population, it was called GERD, gay-related infectious disease.
Yep.
I remember when it was called like a gay cancer.
It was gay cancer, right, because that was the main population. And then we started seeing in other groups, in women, in people that had blood transfusions. It took a while for us to really recognize that it was in the blood transfusions, and we had to start screening blood. And then certainly in populations of color. And it's not that, again, it was not that it wasn't in those populations, it's that they don't have access to care. And that's true. And even in San Antonio, we saw that pattern over the years. The early diagnoses were mostly in white gay men, despite being majority Latino community. Today, the population we see reflects the population in the community. So we have both in our people living with HIV and the people coming for testing, about 65% Latino, which reflects our community, but our Black population is significantly higher. So we see 17 to 20% both coming in for testing, which that's always good, and then living with HIV, whereas City of San Antonio, it's about 7% of the Black community, so significantly higher in the Black community.
And how much of the population is associated with drug use and intravenous sharing of needles?
For new diagnoses, very, very little.
Oh, that's
very
good.
little. Yes,
We're safer.
It's yes. I think. So with the needles, that's actually the syringes that are the issue. We've had a syringe exchange program in San Antonio for a long time with Corazon San Antonio. And we were funded through the Elton John AIDS Foundation for the last 2.5 years with a project with Corazon that included exchanging syringes and then testing in this community. And this is a community with fairly high rate of IV drug use. We found 0 new infections. We were shocked. We expected to find some. We found 0. What we did find were a number of people that tested positive, but then they explained, oh, I was diagnosed years ago, but I didn't know how to get into care. So while we didn't identify new people, we were able to get people into care that had never been in care before. So it was still incredibly effective.
What do you attribute that to, the 0?
I'd love to say it's the syringe exchange program. I don't have enough data to say that. It's causation or correlation doesn't equal causation. But I do think that the syringe exchange has been hugely beneficial, and that organizations like Corazon and a few others have been testing regularly in these communities, and that helps to identify the occasional case. It really drops it down. Education, knowledge about it.
Yeah, that's right.
Absolutely. Now we see syphilis and other things in this population. So.
That's right. Well, with the big celebration coming up, what are the needs? What are the most important needs? Like with the money that will be raised, and hopefully we'll raise a lot of money, how do you want it to be used?
It's going to be used for everything. So I talked about our roof. I talk about that a lot. Anybody that follows me on Facebook knows I talk about our roof. But it is an old building that we're working on fixing. So a lot of it is a basic infrastructure to make sure that we can provide these services. However, our Brian White program, which is the program that funds people living with HIV, so the medical care, housing assistance, meals, case management, all the social support services, mental health, that's been cut substantially.
And y'all provide meals every day of the year.
3 times a day, 7 days a week, right?
Incredible.
365 days. Every day, Elaine.
We do have, HOPWA is another program. HOPWA provides most of the meals and the housing. And that one is a federal program. Fortunately, that one is pretty solid. However, all the other support services have been dramatically cut. So we lost about 25% of our funding, and that's across the county, probably across the state. I haven't seen those numbers yet, but we were told. That's a huge cut, isn't it? So all the agencies are seeing that cut, which means that it's getting more difficult for us to provide services. So all of the funds that we raise goes into the pot that helps to make sure that 65% is funded, but I have to make up that other 35% somehow, and that's where people contributing really make a difference.
And you need your roof.
We need a
You
roof.
need your roof. Let's
Thank
make
you.
it happen.
Right, right.
Thank
Not only does it fall, but the electrical gets
Yeah.
affected. Everything.
Thank you for joining us, Dr. Cherise. Thank you
Thank
for
you so
joining us
much.
on this episode of our podcast.
And we thank you so much as well out there that are listening. You can find our podcast on buenavistaproject.com, on
Apple Music,
Spotify. YouTube,
Spotify.
and Spotify. We'll be back soon with another episode. Until then, hasta
La Buena Vista.